only 3 in 10 Tennesseans are vaccinated. And, well, you're booing yourselves.
I guess you are. Oh, my gosh, is that funny?
Okay. Yeah, well, the big news yesterday is that the CDC panel, which was supposed to meet last week, but they didn't because of Juneteenth, they said there is a likely association between the vaccine and the inflammation of the heart. But they still say, Dan, the benefits of being vaccinated far outweigh the risk.
Yeah, well, they are not providing nuance in the discussion, it would seem, and that makes what they are saying a problem. Professor Francois Ballot, who is at the Genetics Institute, University College London, had an interesting tweet thread on the topic, specifically with child vaccination, since that's effectively where we are. He writes, child COVID-19 vaccination feels like the mother of all ethical minefields. I expected those discussions wouldn't be easy, but the non-trivial rate of myocarditis in teenage boys following mRNA vaccines makes the situation worse than I anticipated. I worry that once most at risk will have once those most at risk will have been vaccinated, the bitter discussions about the ethics of herd immunity strategies may be back on the table. I don't dare envision how toxic the discussion about vaccinating children for COVID-19 could be. And he goes on to suggest, based on data calculations, it's now clear that the mRNA vaccines can cause myocarditis in children and young adults. The side effect is most common in teenage boys with a rate 0.05%, but that has to be balanced. And that's what he says, and what we've said for these many months. This has to be balanced against the risks associated with COVID-19 infection. It's not easy, but for example, the study that he references here reported a risk of hospitalization peaking at about 0.02%, but with 70% of hospitalized teenagers having pre-existing conditions, just as the small fraction of those under the age of 18 who have died from COVID. Some 300 have died over the last year. At the same time, 45,000 people under the age of 18 have died from all causes, just to give you some proportionality. But the risk of the vaccine for young people versus the risk of COVID for young people, that's what the conversation should be, rather than just mindless get vaccinated, or everybody from in utero to the oldest person in the world get vaccinated.
Well, now Dr. Fauci's in. He's like, the only way to eradicate this is everyone gets vaccinated.
Yeah, well, he's got some problems, including, perhaps from an unlikely source, George Gresham, who's the president of SEIU, United Healthcare Workers East, the largest healthcare union in the country, said hospital systems don't have the right to mandate vaccines for employees. Well, tell that to Houston Methodist.
Yeah, 123 people are out of a job.
But now you have the unions, public sector, well, not just public sector, private sector here with respect to healthcare workers at healthcare systems, hospital systems, saying, no, we're going to fight that.
Well, CTU's fighting that because CPS wants mandatory vaccinations for the teachers, and they said we're not doing that. But yet the CTU wants our kids to be all vaccinated.
So the pitched battle persists. For more on the topic, pleased to be joined by Dr. Robert Malone. He is a specialist in clinical research, medical affairs, regulatory affairs, project management, and proposal management, vaccines and biodefense. He's the discoverer of in vitro and in vivo RNA transfection and the inventor of mRNA and DNA vaccines. And we'll have to have him explain most of what I just read. Dr. Malone, thanks for joining us. Appreciate it.
And I wanted, allow me just to do a shout out. I'm a graduate of Northwestern University Medical School.
Yeah.
And my wife used to work for the Brookfield Zoo, so I'm very glad to speak to Chicagoland.
Well, I'm a graduate of Northwestern undergrad, and I usually issue an apology after I say that. But Northwestern Medical School, that's a little bit more serious, so we'll respect that. Probably just under working for the Brookfield Zoo in terms of status. So I saw this. Speaking of tweet strings, I saw this that you posted on Twitter, and I thought it was a provocative question. Then understood your background; it became that much more provocative. You tweeted out, "What happens to confidence in public health if ivermectin turns out to be safe and effective for COVID, and the genetic vaccines turn out to have significant safety issues?" Yeah, what happens, particularly if in the case of children?
And you saw that one went viral with a lot of commentary People are very engaged on that question. What I kind of intentionally didn't say was the third leg on that stool, which is the lab leak issue, and that one is getting curiouser and curiouser.
Well, right, but speak to the vaccines and the discussion now, including with that University College London professor's comments about vaccinations for children under the age of 18, or now even under the age of 12, which is sort of where we're at.
Before we go there, can I comment on the Tony Fauci statement?
Sure.
The problem with Tony's comments about herd immunity with these vaccines is that all the endpoints that we focused on are disease endpoints. These vaccines, the 90% efficacy is about protection from hospitalization and death. It's not about protection from viral spread. These vaccines are not sterilizing. You still get infected. Many people still get infected. They still shed virus. They can still transmit virus. Calculations about herd immunity require an agent or a strategy that will be able to block virus transmission, not disease caused by virus. Okay? And so, Tony, I have an objection to all this chatter about generating herd immunity based on X% of uptake of vaccines, whatever it is. 70 is one that's often cited. That's not data-based. Okay, those arguments, anybody, frankly, I've said this in another tweet, anybody that's asserting that they know that we can get to herd immunity based on these vaccines if a certain percent of the population takes them doesn't know what they're talking about. This is fundamental.
Right. But I mean, Dr. Fauci was saying we're going to eradicate COVID if we all get vaccinated now. And if we don't, there might be more lockdowns in the winter.
It's okay. So what we call that is coercion.
Okay.
He's making a threat. If you don't do this population, remember he's cloaked himself and said basically he is science. Mm-hmm. And if we disagree with him, we're anti-science. Okay. Mm-hmm. I'm sorry. I am all about science, but I strongly disagree with Tony. Tony is substituting often his opinion for facts and for data. And we have to get back to data-based decision-making, to science-based medicine. Okay, so these statements about eradicating COVID, in my opinion, there's no way that we are going to eradicate COVID from the SARS-CoV-2 virus and its variants from the human population. If we could have eradicated polio, we would have. So these statements are gross oversimplifications of the complexities that we have. But that wasn't really what you wanted to talk about. You wanted to talk about childhood vaccination. And I strongly agree with the WHO in their switch in position that at this point in time, childhood vaccination is not recommended. But I object on an even deeper level. I kind of been out front with some arguments about the bioethics. And here's the thing. These are experimental vaccines, full stop. Okay? You can't deny that these are experimental. They have not yet been approved. Therefore, they fall under a whole cascade of consensus in the West, at least, about bioethics of medical research. This goes back to the Nuremberg Code. It goes to the Helsinki Accords. It goes to the Belmont Report. And oh, by the way, it's codified in federal law. We call it the Common Rule. Common Rule has three key elements. First off, there has to be full and open disclosure of risks to anybody that is going to take an experimental product. And by the way, only adults are able to give consent. That's why we call it the age of consent. Okay, so there has to be full and open disclosure of risks all the way down into the weeds, just like you see in a package insert. Number two, those risks can't be hidden with fancy medical terminology. They have to be stated in a way that average people of 8th grade education can understand them. Okay, so simple language, people have to comprehend it. Number three, the encoded in the federal law is that for experimental products, people have to willingly accept the participation in what is essentially a medical experiment. They have to willingly accept it based on their understanding of risks. This is bedrock bioethics. We cannot coerce people. That means pressure them through social media, through government announcements, through denying potential risks, through gaslighting them, through censoring and not allowing discussion. I mean, we've crossed some lines here, and some countries are down in the weeds of, I can't believe that I'm saying this, offering ice cream to children so that they can get jabs without their parents' approval.
Well,
wrong. It's wrong.
I want it because to me, is that any different? I mean, it's the same thing. We've talked about this, but this has not been criticized. Concert tickets, booze for young adults, and potentially for
shotgun lotteries in West Virginia. I mean, it's all the same thing. This is not okay.
You find this all unethical?
It is grossly unethical. It's a violation of federal law.
Mm-hmm.
Well, so 26 million kids 18 and younger were given doses of Pfizer and 323 cases of heart inflammation. That's such an infinitesimal number. I mean, would that have happened anyway, regardless if they had the vaccine?
Okay, I'd like to talk about the incidence. No, yes, the answer is no. So I'm concerned. I don't work for CDC. I don't currently work with CDC, but those data are based on the vSafe and the VAERS databases, which are voluntary reporting. Those databases grossly underreport events, adverse events. So I'm not clear how the CDC can calculate a ratio by taking the known total number of doses as the denominator and the reported number of cases of cardiac inflammation as the numerator, as the upper number in the ratio. Mm-hmm. I know they don't have data on the total incidence of any of these adverse events. And so, again, my opinion, personal opinion, is the government is not being fully transparent in disclosing risks, and they are obligated to do so. And this ratio is, I know they don't have the data to say what they're saying. I'm very uncomfortable with this. Furthermore, there are some fundamental, this is down in the weeds of biostatistics, but the two key words are confounding variables and masking. The reason I believe why these signals are apparent in the adolescent population is because they have essentially no background level of this type of disease. Adolescents don't get heart attacks, right? They don't get cardiac things except very, very, very rarely.
Right.
As opposed to, as you get into older cohorts, it's fairly common. The problem is that the signal from those fairly common events that normally happen in older adults make it really hard to see the signal that might be related to vaccine. And it also makes it really easy for people that are making decisions about whether or not something is related or unrelated to vaccination to say, oh, it's just a cardiac event and this is an older male.
Right.
Therefore, it's not related.
Well, and
so there are intrinsic problems with this analysis, and I am not comfortable that we've got to the bottom of this yet.
Well, and to your point, neither is Harvey Risch, epidemiologist at Yale, and Joe Ladapo, who's at UCLA's Geffen School of Medicine, their op-ed suggesting the same thing. They took some of the VAERS information and issued all of the caveats you just issued, and then say, but here we still see arcs in these sort of 4 categories of adverse outcomes that require further study before anybody should be running around.
That the FDA, there's another one that they missed that the FDA is also aware of, but it's not yet officially disclosed, which is reactivation of latent viruses like shingles.
Okay. And
I agree with the assessment in that editorial. I was very grateful. I mean, I've been out. For me, this is a huge professional risk. I'm a consultant. I work closely with the government, but I felt like I needed to speak up about the bioethics and some of the fundamentals here. And as you know, it was the Brett Weinstein podcast and my comments and editorials on Trial Site News that kind of drove me into the public sphere. I generally don't seek, I'm not somebody who seeks media attention. It's not good for my business. And all of this is not good for my business. I'm not doing this to make money. Matter of fact, it's hurting my business. But I think it's important to say it. And I completely concur with the two gentlemen. And I was very grateful to see that published in the Wall Street Journal.
Well, we appreciate you coming forward as well. We need people to provide leadership based on their expertise, and you're doing that. He is Dr. Robert Malone, who is the discoverer of in vitro and in vivo RNA transfection, the inventor of mRNA and DNA vaccines, and a specialist in clinical research in a number of other areas. Dr. Malone, thanks for joining us. Appreciate your time.
Thank you for the opportunity, and hello, Chicagoland. Thanks.
Thank you. And he joined us on our turnkey.pro answer line.
This is Chicago's Morning Answer.
Your show keeps me alive during the week. There's nobody I'd rather listen to between 5 and 9 in the morning than you guys.
On AM 560, The Answer.
For commercial and industrial roofing, Waukegan Roofing has been the gold standard for Chicagoland since 1914. They have you covered, literally. Nothing matters if your business roof isn't right. Contact them for an analysis.
Bruce Diedrich here from Waukegan Roofing. It's that time of year again. Waukegan Roofing has been installing and maintaining roofs you can rely on for all of Chicagoland. Our experienced team of service technicians is the right solution for your new or existing roofing system for years to come.
The average field employee has been with the company for over 10 years. Professionally trained Local 11 union roofers with OSHA safety certifications. What does that mean? They know what they're doing.
From early detection to preventative maintenance and repairs. Call Waukegan Roofing today at 877-ROOF-201. That's 877-ROOF-201. Or visit us online at waukeganroofing.com. Waukegan Roofing, installing roofs you can rely on since 1914.
Illinois licensee 104000761.
If you own or run a small or mid-sized business, listen up. We know last year has been